Kayla. I'll be working with Sean, Celinda, and Yakira, and we're presenting a case of low back pain. So we have 42-year-old Miranda, who presents to the clinic with low back pain. She stated that this pain has been ongoing for several years, but she noticed a recent flare about a week ago after a long amount of housework or a long day of housework. She reports her pain as getting better with rest and ibuprofen, and worse with prolonged movements in walking and forward bending. The pain is primarily localized in her left PSIS, kind of down her left leg, all the way to her left knee. She denies any fever, swelling, redness, or any changes in her urination or bowel movements since her back pain. Upon more history taking of this case, Miranda's past medical history, she currently has hypertension, which is being well controlled. She also has had an appendectomy as well as a cholecystectomy in the past. She's currently on lisinopril, about 10 mgs QID for her hypertension. And she's also taking ibuprofen for 100 milligrams QID, and this is for her current pain of her low back. Supplements, she's taking a multivitamin, 2 capsules per day. And her family history, her mother and father are both alive. Her mother is 73 and just mildly obese, and her father is 77 with a history of hypertension. She is married to Warren. They have 1 child, and she works as a general surgeon at Grace Sloan Memorial Hospital. She enjoys her job as well as her marriage. She denies any alcohol or recreational drug use. For exercise, she doesn't really exercise besides casual walking. She sleeps about 6 hours a night. Most nights it's restless sleep, and she feels somewhat relieved and refreshed in the morning. For her diet, she eats bacon and eggs for breakfast. She doesn't normally eat a snack. For lunch, she has just a salad from work. And for dinner, she has baked chicken with mashed potatoes and string beans. For beverages, she drinks about 40 ounces of water daily, and about a 32-ounce Diet Coke and 2 cups of coffee every day. On our physical exams, we found that she reports pain on Valsalva. She also had a normal range of motion in her lumbar spine, of flexion, extension, lateral bending, and rotation. And she also noted a little bit of pain upon forward flexion and extension of the lumbar spine. There was also some pain upon hip flexion of the left hip. All major muscles of the lower extremities were 5 out of 5. Positive Victorous bilaterally, so it's both on the right and the left side. Positive straight leg raisers bilaterally, on the left side. Positive Patrick's test on bilaterally, and positive Yeomans bilaterally. There is also a decrease in her deep tendon reflexes in L4 and S1. And other than that, all of our findings of our orthopedic exam are normal. So for this way, we are considering a low back pain lumbar radiculopathy, and we're thinking it might be due, or her back pain can be due to a herniated disc. For labs, we're going to run a CBC with differentials just to rule out any inflammation. And we're also going to do a urinary analysis to rule out UTIs, which can present with low back pain as well. Complete chemistry panel will rule out any complicated metabolic diseases like diabetes, which can be associated with sort of the sciatic pain that she's feeling. For imaging, we're going to order a plain X-ray of the lumbar spine, once again just to rule out any degenerations or changes in her lumbar spine. A CT scan, if she does have a herniated disc, this can be caught or seen in a CT scan. However, an MRI would be a better way for us to determine if there is a herniated disc, the location of the disc, and the actual size.
So based on the physical exams and the lab findings, we decided to do a hot sits bath for the treatment of the patient. So basically we chose this because it's powerful mechanisms for the lower portion of the body. So basically the patient will be emerging themselves of the pelvis, the buttocks, and the lower abdomen. So the amount of water we would want to use is a 1/2 inch above the navel area. The temperature would be 106 to 110 degrees Fahrenheit, and the foot bath would be 110 to 112 degrees Fahrenheit. The duration would last 3 to 8 minutes, and frequency, we would like the patient to do 2 sitz baths, one in the morning as well as one in the evening for 7 days. So basically, the positive effects that will help is it helps with the spinal cord reflexive effects to underlying pelvic and abdominal organs. So basically, since the patient is receiving treatment to the abdominal organs, that will then internally affect and help the nerves in that area. It also will minimize congestion in the area, as well as provide relaxation for the patient. And lastly, it will help decrease inflammation in the area.
We would like to discuss a potential at-home treatment that the patient could also use as an alternative while they can't come to the clinic, that they could potentially use overnight to continue the healing process. So that option would be a poultice. And a poultice is basically where we would take an herb, and in this case, we chose to use hypericum herb, also known as St. John's wort. And we would use that herb, powder it, and turn it into a paste by adding hot water. Once we do that, we would add that paste onto a cotton and put that cotton on the lower portion of the patient's back where they feel the pain. Once we do that, we're going to wrap that cotton up in plastic and then wrap the plastic in wool. We would leave that on for 8 hours again while they're sleeping to help increase blood flow to the area. And we specifically chose hypericum herb and thought it was appropriate because it's helpful for nerve-like pain. Now, the goal of both the treatments for the sitz bath as well as the poultice is to increase blood flow to the area, as well as reduce any inflammation and potentially relieve the patient's pain. Now, thank you guys so much for listening in. These are our references. And for those of you who may be experiencing back pain, please know that this is not medical advice that we're giving. If you have any pain that you're experiencing, please consult your physician or doctor. Thank you so much.